To set us up with a strong foundation to build upon, we'll kick things off by providing an overview of cost accounting principles, and we'll talk about the application of those principles at healthcare companies. We'll also talk about some of the challenges that companies want to use cost accounting to help solve. So, this conversation will set the scene for the remaining sections in this course. Starting at the highest level, cost accounting is just a system that accountants and finance professionals use to record and analyze costs that ultimately support the financial decisions of a company. And the goal or the focus here is really around managing and reducing costs in an effort to improve the efficiency and ultimately the profitability of an organization. And there's a couple of key reasons why this is such a huge topic when it comes to healthcare companies in particular. First, healthcare companies need to operate on tight margins. A lot of hospitals out there report operating margins that are at or below 3%. And there's even some hospitals that have to operate on negative margins. Studies also show that the average profit margin in a healthcare organization is around 0.7%. That doesn't leave a lot of room for error. So, if we can provide even small enhancements to boost productivity, that alone can be a big win for these types of organizations in the healthcare industry. On top of that, a lot of these healthcare organizations need to be able to provide price transparency. When we think about nonprofit hospitals in particular, there's a lot of financial data that they need to track, and a lot of this needs to be reported so they can retain their tax exempt status. As a quick example of this, it's possible for an individual donor to restrict how certain funds that they donate can be used by that nonprofit organization. So, if a hospital that they donate to has a strong understanding of the cost of different services or procedures that they provide, they know with a pretty high degree of accuracy just how those funds can be used and how many services or procedures they can help support. The next reason cost accounting is so crucial is because even in a singular organization, costs can vary pretty widely across different departments or services. As an example, let's think about a medical group that offers a number of different specialties like pediatrics, orthopedics, and cancer care. The costs and ultimately the profitability of these different services can vary pretty drastically. And in cases like that, it's not unusual for one specialty in the company to effectively subsidize some of the other specialties that are less profitable. Management can make better decisions when they understand certain key data points that are related to each service, like their overall cost, their operating margins, and their profitability. And this can help management identify areas where efficiency improvements are needed. We can also look at areas where specialties might need additional investment, or even in the most drastic cases, when services might need to be cut from an organization because they're underperforming. Lastly, organizations that operate in the healthcare space need to be financially stable. Financial stability is table stakes for allowing organizations to retain good staff, provide quality care, and ultimately stay in business. There's an old saying, what gets measured gets managed. Without key insights that cost accounting provides, leadership might basically be left in the dark, making decisions off their own intuition and not making it off of data. It's not a good place for a business to be in. So, as accounting and finance professionals, one of our primary roles is to provide the cost accounting data that helps management make strong decisions based off of high quality data and insights that they can use to drive the business forward. Now, when it comes to the different types of costs that come about in a healthcare organization, there's four primary categories that we'll introduce here, and we'll use a lot of these terms throughout the rest of the course. And while these terms aren't necessarily exclusive to the healthcare industry, we'll give some common examples of these different types of costs at different healthcare organizations. And it's likely that you've probably encountered most, if not all of these types of costs in either your personal or your professional life. So, starting from the top, we have direct costs. And generally speaking, direct costs are expenses that can be directly attributed to a product or maybe a project depending on your line of work. In the context of healthcare organizations, direct costs are usually expenses that can be traced to a specific patient or maybe a department or a procedure. It's usually pretty easy to track exactly how much of a direct cost is used in one of these cases. So, taking a quick example, it's pretty straightforward to know the cost of anesthesia that's given to a single surgery patient, or in a different example, the cost of a diagnostic test that gets run on somebody who maybe has a broken bone or some other similar type of injury. In contrast to direct costs, we have indirect costs, and these are commonly known as overhead. Now, indirect costs can't easily be tied to a single product or patient or project. Since it's difficult to figure out how much of these costs are directly attributable to, again, a certain patient or procedure, we need to have a way to share or allocate these costs across multiple departments or services within the organization. Because of the complexity when it comes to indirect costs, we'll spend a good chunk of this course talking about the different ways that indirect costs can be spread across a healthcare organization. The other two types of costs, and I'm going to loop these two in together, but the other two types of costs that you're likely to be familiar with are fixed costs versus variable costs. And fixed costs are static in nature. They don't change based on certain factors or variables. In contrast, variable costs do change based on certain factors. And this comes up a lot when you're talking about someone's personal budget, for instance. And we start out with their fixed costs. Maybe it's their rent for a year or a monthly payment on a student loan. Those are two common examples. The same amount is due month after month or year after year. It's very static in nature. We don't have a way we can adjust the amount of those payments. But in contrast to this, we do have a way to influence variable costs. And these are things like gas and entertainment, for example. By going out less or maybe ride sharing, we're able to fluctuate the amount of these costs on a month to month basis. So when we talk about these costs as they relate to healthcare, fixed costs remain the same regardless of patient volume. Think about things like the monthly payment on a hospital building, or staff salaries, or depreciation expense. Variable costs, on the other hand, are things like medical supplies and medications. As the volume of our patients increases, we'd also expect those types of costs to increase as well.